Welcome back, my beautiful friends. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I'm your host, Zen Sams. Up in just a few minutes, in our My Healthy Minutes segment brought to us by Revere Securities, we are featuring the amazing Dr. David Rankin. He's founder of Aqua Plastic Surgery in Jupiter and Miami, Florida, and the chief of plastic surgery at St. Mary's Medical Center in West Palm Beach, Florida. Now, Dr. Rankin has been in practice for 20 years, but recently he has become very well known in the B.I.I community, that is breast implant illness. Now, interestingly enough, Dr. Rankin stopped implanting women close to 5 years ago to focus on specializing in the explanting procedures. Today, we're chatting about breast implant illness, what it is, and how often you should be screening your breast implants, even if you have no alarming symptoms. For starters, after a breast augmentation, you may assume you're set for a decade or so. However, FDA recommendations urge patients to get their implants screened much more regularly. And a recent study found that the majority of breast implant patients aren't compliant with the screening recommendations, myself being one of them. Now, these screenings ensure the implants have not silently ruptured, so to speak, and the research shows that less than 6% of respondents had undergone MRI screenings in accordance with these guidelines. Now, a majority of the patients say they weren't aware of these recommendations. Again, myself being one of them. So the good news is that the good doctor has come on to shed some light on this. Now, what is breast implant illness? Well, for some, having their chest augmented is a dream come true. But for others, that dream slowly becomes a nightmare in the form of a mysterious sickness dubbed as breast implant illness. And back in October of 2021, federal regulators placed a so-called black box warning on these breast implants, packagings, and sorts, and they told manufacturers to sell the devices only to health providers who review the potential risks with patients before surgery. And here to chat some more is the good doctor, David Rankin of Aqua Plastic Surgery, one of the country's leading explantologists. Welcome to the show, superstar.
Thank you very much, son. It's nice to be back. Nice to chat with you.
Absolutely. Okay, well, let's get to it. It was actually a decade ago, Dr. Rankin, that the FDA first identified a possible link between breast implants with a textured surface and a particular cancer, anaplastic large cell lymphoma. But we're only hearing of this just now. Why is this the case?
Well, I think that there's a lot more education, a lot more awareness not only in the medical community, but in the social media community. So women are talking to each other, and they're really bringing up this topic as an important women's health topic that needs to be discussed.
And interestingly enough, about 400,000 women in the United States get breast implants every year, 300,000 for cosmetic reasons, and about 100,000 for reconstruction after mastectomies performed to treat or prevent breast cancer. So this is actually a very serious number because we have a large percentage of women getting breast augmentations. So let's chat screening these guys. So insurance companies have become a bit more flexible with regards to the use of diagnostic ultrasound, DUS. That's the terminology, DUS. And it's important that I note this because people are asking their insurance companies to cover this. So instead of an expensive MRI, so to speak, diagnostic ultrasound is an alternative, and it can help verify implant integrity, orientation, periprosthetic fluid, capsular calcification, and in the case of older implants, gel bleed and extra capsular gel. But while most people don't experience these types of complications, so to speak, Dr. Rankin, identifying a rupture is important and critical, especially if you have implants. How would a patient go about getting this approved with their insurance company, and how often should we be screening?
Well, when the silicone implants were put back on the market in November of 2006, they were recommending regular MRI screenings, which a lot of patients did not comply with or weren't aware of. The FDA has changed their recommendations recently, like you talked about, to at 5 to 6 years, you should get an MRI or ultrasound. It used to be MRI only, and it's nice that it's an ultrasound now because it's a much easier study. It's cheaper, easier for the patient to comply with. After that, it's every 2 to 3 years, you should have another MRI or ultrasound as well. As far as insurance authorizations, it really depends on the patient and their insurance company. I do think that they're becoming a little bit easier to go through at this point, but it can be a struggle for some, and some patients have to pay out of pocket.
Yeah, I mean, the reality is that most patients don't want to do screenings if they're not having problems. That's the bottom line. And patients are hesitant to heed, to heed the warning, so to speak, or to even head to the doctor's office when there's no obvious cause for concern. But however, there are also bigger barriers at play, like you mentioned. The lack of access to care and costly screenings are a huge part of the reason patients aren't adhering to the guidelines. The insurance company not automatically authorizing an MRI, so to speak. But let's talk about mammograms and implants. Okay, so the majority, we're going to say 62%, so to speak, of problems reported were for breast implant rupture that was suspected to occur during mammography. Now, the rupture during compression for mammography was reported for both silicone gel filled and saline filled breast implants. Now, other adverse events reported to FDA included implants crushed by mammographic compression, pain during mammography attributed to the implants, inability to perform mammography because of capsular contracture or because of fear, so to speak, of implant rupture by the patient. And of course, this leads to delayed detection of cancer, all attributed to breast implants. What is your advice on mammograms and implants? And if, per se, a woman like me who is refusing to get mammograms as a result of potential rupture, what do you recommend?
Well, breast cancer diagnosis and screening is a very, very serious issue for women. And I think that you need to listen to your breast doctor as far as the recommendations for screening. I think mammography in many women it's definitely indicated for detection. MRI can be a substitute in certain circumstances, and that's non-invasive. It's not compressive. So when that is a possibility, I definitely recommend MRI over mammography. I think it's true that the implants can already have their integrity jeopardized beforehand with capsular contracture or with time, and a mammographer can compress the implant, and I have seen many ruptures in those situations too. So everyone has a specific set of circumstances that you need to talk through, but you can't not do breast cancer surveillance because you have implants. That's really could be a detriment to your health.
I guess we're stuck between a rock and a hard place, and you, being the good doctor that you are, chose to only focus on explanting for this reason. And I completely understand where you're coming from as a result of that, based on just even what we're talking about. But when you look at the Food and Drug Administration, so they're now requiring manufacturers to disclose the ingredients used to make breast implants, and information to patient and patient advocates is extremely important in terms of what these ingredients are. So, what exactly is or are in these implants, so to speak, that may be making women so sick? And is it all implants across the board?
Well, we don't know is the short answer. There are a lot of proprietary and now not as much proprietary ingredients in these implants, which are now presented to the patient. But we don't really know what the direct cause with B.I.I. is. It can be just an autoimmune type reaction to a foreign body. It can be some of the chemicals in the implants. It can be direct allergy to the silicone. These are things that are being studied, but there hasn't been an evidence-based link as of yet to say this is exactly why the problem is happening. It's two women, same implant. One can be fine and one can have B.I.I. type symptoms. It's important to note that even saline implants do have a silicone outer shell filled with saline. Silicone implants have silicone gel within a silicone outer shell too. So in my practice, silicone and saline implants are both causing B.I.I. in a certain subset of women for sure.
Quite perplexing and quite profound, quite profound. Now, what are the main symptoms and how long after implanting does BII present itself when it does? I mean, what are the main red flags, so to speak?
My patients have symptoms from A to Z. The ones that are recognized by the Food and Drug Administration right now, you can go on their website under breast implant illness, are brain fog, anxiety, joint pain, allergies, food intolerances that develop later in life. I see a lot of others too, which you have to consider anecdotal at this point, but I see so many women with the same issues, where more often than not, removing the implants solve the problem.
Well, you know what? These segments, and now this is the third or maybe even fourth time I've had you come on because I value your expertise, and not only your expertise, but I value your ability to see the other side of that 20% or so women that are experiencing breast implant illness. I myself have breast implants. As you know, I've made it public to the world. I've had them for about 11 years with no symptoms, no issues, but I'm at the point where I have to figure out if I'm going to replace these guys or if I'm going to be explanting and going natural, which is the decision I'm leaning towards. But your commentary and your ability to come on our platform and to really tell the world the truth about what is happening, especially after the FDA has issued these black box warnings since October of 2021, so to speak. But the fact that you have stood your ground as a professional, as a surgeon, accredited professional that you are, and have said, I am no longer implanting, for me speaks volumes, and I'm sure for many women. So I thank you for that.
Yeah, absolutely. I enjoy helping these women on their health journey and trying to make them whole again. And I really sympathize with their issues. They've been to a lot of different doctors, specialists, can't get answers. It's really affecting their life. And this is really a final decision for them. And fortunately, it helps many patients. And I'm fortunate to be part of that.
Well, I want to thank you so much for coming on. It was an absolute pleasure having you on again and again. And I'm going to invite you on again and again, Dr. Rankin. Thank you so much.
Thank you, Zen. I appreciate it.
That was our My Healthy Minutes segment brought to us by Revere Securities. You can find Dr. Rankin directly on their website at aquaplasticsurgery.com, or you could find them on the gram at Aqua Plastic Surgery. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. We'll be right back after this.